Hi, my name is Denise. Today I will talk to you about the effects of pompage technique, whether combined or not, with LED photobiomodulation on pain and disability in patients with chronic neck pain, a protocol for a controlled, randomized, and blind study. The neck pain is a syndrome that affects the cervical region, causing acute or chronic pain. This dysfunction can affect 10 to 14% of the economically active population. There are some causes for this dysfunction: mechanical and postural changes, osteoarthritis, herniated discs, arthritis, muscle spasms, and psychological and emotional factors like stress, depression, and excitement. It can lead to orthopedic, neurological, or rheumatological changes. It's a significant social issue associated with work absenteeism, disability, and reduced quality of life. There are some treatments for this dysfunction: laser and LED photobiomodulation, pompage and others manual therapies, and pharmacological therapy too. Photobiomodulation with laser and LED has some advantages. It's a non-invasive technique, painless therapy with no side effects and cost-effective. Pain reduction, inflammation reduction, and accelerated healing. Pompage is a manual technique that combines mobilization and sliding of the muscle fascia, reducing pain, improving range of motion and function. Rationality of the study: access the possibility of enhancing therapeutic effects on the musculature, pain, and range of motion in the cervical region using the PBM with a LED cluster. There are no studies associating pompage with photobiomodulation to improve neck pain. Aims: the primary aim is to assess the effects of pompage with or without photobiomodulation using a class of LED on pain and quality of life in patients with neck pain. Secondary aim is to evaluate the following parameters with the proposed treatment: pain, mobility, quality of life, and functional capacity. Methods: it is a randomized, controlled, and double-blind clinical study. The randomization is in a 1-to-1 ratio using blocks of 4. The sample size of 56 individuals divided into 2 groups of 28 each. There will be 2 groups, Group 1 and Group 2. Group 1 is a placebo group. In this group, patients will receive pompage technique in the cervical region and PBM with the device turned off in 10 sessions conducted 3 times a week, excluding weekends. In Group 2, the patients will receive pompage technique in the cervical region and PBM with the device turned on. 10 sessions conducted 3 times a week, excluding weekends. In the inclusion criteria, there will be men and women aged 18 to 55 years who have mechanical chronic neck pain without any concomitant treatment. For the exclusion criteria, patients who have disc degeneration or spondylolisthesis in the cervical region, rheumatic or degenerative diseases in the cervical region, currently undergoing orthodontic or physical therapy treatment, and initiation of any medication during phase of the study. The experiment breakdown. We will have recruitment, first treatment, second to 10 sessions, and last treatment session for conduct the students. On recruitment, we are going to make a group selection process using inclusion and exclusion criteria. For the included patients, we are going to first treatment session. In the first section, we are going to make an assessment, analyzing pain intensity, range of motion, quality of life, and function capacity. After that, we will make a randomization and divide the groups. Group 1, pompage and LED and turn-off model, and Group 2, pompage and LED with cluster of LEDs. The treatment will be made in 10 sessions. In the last treatment session, we will make the post-treatment assessments to analyze pain intensity, range of motion, quality of life, and functional capacity. And 4 weeks post-treatment, there will be another assessment to analyze pain intensity and life quality. It is a double-blind study. A single researcher from the group will oversee the interventions and will be aware of the intervention performed on each participant. Another researcher will conduct the initial outcome assessments and follow-up evaluations, blinded to the experimental and control groups. The statistical analysis will also be conducted in a blinded statistician who will receive the data without group identification. The patient will be blinded to the PBM treatment. In Table 1, we demonstrated the technical parameters of the photobiomodulation treatment we are going to use. Thank you for your attention.